The Milestones series on recovery, tracking the milestones of the recovery world, chronicling the industry leaders, revealing their insights. Milestones, saving families, saving lives. John, tell us about the major contribution that you're making to the industry.
I think the major contribution that I'm making to the industry is having been honored to take over the Bridge to Recovery about 3 years ago. That is nearly 40 years old.
What is the Bridge to Recovery?
The Bridge to Recovery is a private, not-for-profit organization that focuses on family members or individuals struggling with codependency, trauma, process addictions, or constantly relapsing with drug and alcohol or other addictive behaviors.
What does the term Bridge to Recovery mean?
It was defined as people needing to get into recovery and not really understanding how or having the tools or the skills to do so. And they literally built this bridge to offer people to come into the program. So it's basically a bridge to go from bad situation to good situation.
So if we think about a real bridge, we're going from this side of the land to that side of the land.
That's right.
We're crossing the water, we're crossing something.
Yes.
In the Bridge to Recovery, what are we crossing and where are we going?
We're crossing some of the behaviors that they have picked up over transgenerational times and compounded traumas that have started as early childhood and have continued with those behaviors into late 50s, 60s, 70s. They become anxious, they fall out of life, they don't want to live any longer, so they'll end up self-medicating. That's a major traumatic event, but most people experience trauma, whether it's small traumatic events or large ones, or compounded over the course of their life that lead them to not being able to feel emotions. They suppress those emotions, they suppress the feelings, and that's what causes them to also do drugs, alcohol, and other behaviors. So we're trying to take them from bad behaviors to healthy behaviors.
So when you're talking about not feeling the feelings, not being aware of those feelings, denying them, suppressing them, repressing them, you're talking about everyone that really is abusing substances.
Everybody, absolutely. Not even just substances, but codependency. Trauma will lead to codependency as well, and people don't realize it, but codependency is equally as debilitating, if not more, than drugs and alcohol combined.
In what sense?
It will cause a person to lose themselves or their life because they are giving themselves to anybody and everybody other than taking care of their own needs.
So a person that's codependent is literally giving away their power to someone else or anyone else, in the same way that someone that has an addiction is giving away their power to the drug.
Even more so, because they're giving their power to maybe that person, their loved one, their spouse, their child, or what have you, that is losing their life to drugs and alcohol, and the codependent will enable them to such a degree that they lose themselves and they're not helping, they're sabotaging their loved one from getting the help that they need.
So part of your Bridge to Recovery, some of those bricks across the bridge, are actually dealing with those deeper emotions.
Absolutely. That's exactly what we do. And why we're unique, we will dig into those emotions, teach the person that they aren't feeling their emotions, and then be giving them a safe and secure environment to deal with those, to begin to learn what they are, bring them up, and deal with them as time goes on. So a person who goes in thinking they really don't need help, they learn what it is that they do need, and that's why 90% of people that go into a 2-week program at the Bridge Recovery end up staying for as long as 12 weeks.
Where are the centers that you work with?
The first center was founded in Bowling Green, Kentucky, just 90 miles north of Nashville, Tennessee, and that was founded back in 1972, and we have just successfully launched and replicated a program in Santa Barbara, California.
And what's your connection and relationship to Milestones Ranch, Malibu?
Well, Milestones in the Bridge Recovery works on family systems. So the identified patient who needs the deep work here at Milestones Ranch, Malibu, often we will take care of the family member who is sabotaging and not allowing their loved one to get the work done here at Milestones.
So real healing isn't just dealing with the individual patient, it's dealing with the entire family, the The entire clan.
Exactly, and not just one generation. What we have been able to do over 40 years is work with multiple generations of individuals that need help.
And you've had such a great life experience, and you've obviously traveled the world. For what, John, are you grateful?
I'm grateful to be able to do my calling, and often people don't even realize what your calling is. Over the span of my career in 35 years in healthcare, 25 in the behavioral health field, I've learned my calling is to help people find their feelings and get better. And it's an honor to be in this field.
And professionally, what are you grateful for?
To be able to work with some of the most compassionate people in a field like we get to work in. This is a very small industry, but to be able to work with Denise Klein and Dave Casey and these amazing people that have the same passion and compassion for what they're doing, it's such an honor.
What do you see as the greatest developments within the industry?
I believe we're going through a paradigm shift after 4 decades of this field growing. I believe we're finally getting back into working collaboratively, more successfully, and really focusing on the family systems and all the different individuals and what they need. You can't treat one person in a family and be able to help the entire family.
So John, you talked about 3 significant things. You talked about the significance of working with the family, collaborating, and really dealing and seeing the individual.
Absolutely. The third aspect is we are in a field of compulsive caretaking ourselves, and there's tremendous burnout of the professionals in this industry. The third aspect that we deal with is we treat professionals within the industry.
You treat the people treating the other people.
Absolutely. Because how can we help families and individuals without being healthy ourselves? So it is often that we have professionals going through our program at the same time with others.
It must be very difficult, even humbling, for a professional to say, I need professional help.
It is, but those of us in the industry that see that they do need help and the ones who have gotten help are offering such testimony that others are opening up all the time, and that really is the paradigm shift. We have to help our own before we can help others.
And of course, that's the point, that if I'm helping other people and I help myself and I become healthier, then I can help people even on a bigger scale, a grander scale.
Absolutely. And it's not just the drugs and alcohol. The process addictions that we deal with are those external dependencies, compulsive caretaking, workaholism, religion addiction, sex, love, relationship, gambling, gaming. Misery addiction is one that we talk about quite often.
So why is collaboration within the industry critical to the success and the benefit of families and individuals who are in recovery?
If we ignore the families other than the identified patient, you try to help the identified patient, the drug or alcoholic, and they go back into equally a sick family without knowing how to deal with them, and now you're not supporting them, and that's exactly what causes high recidivism rate. You have to treat the whole family, and it's a transgenerational thing. It's one generation to the next, to the next, to the next, and you have to stop it.
And why is collaboration within the industry so critical?
I'll give you a good example. There may be somebody here at Milestones that is being treated, but their adult parent are sabotaging and continuing to pull them in and out, enabling them to go back into their own disease. If we don't work collaboratively together and leverage the mom or the dad to get help at the bridge to recovery, then that identified patient will continue to relapse and be able to be unhealthy. So we have to work collaboratively.
And John, what do you see as being unique and valuable and special about Milestones Ranch Malibu?
Milestones Ranch is one of the most comprehensive programs. They take care of the co-occurring individual, the drug and alcohol, their compassion, their level of expertise, medical model, the clinicians, the technicians that work here are absolutely phenomenal.
John, you move through life, based on the few minutes we've spent together, with an open heart. It's very obvious, and it's obvious that you have a playful heart, and you're very loving and you're very giving. You've obviously made a huge impact in the industry, and you continue to do that, and you've been doing it for 30,000 years or something. So I just want to say thank you and acknowledge you on behalf of all the people that haven't had the chance to personally say thank you.
Thank you for this opportunity.
Thank you.
Okay.